I had the opportunity to present my research just yesterday at ASCO 2026, and I also received the Bradley Stewart Beller Endowed Merit Award for this project. So we wanted to examine the impact of mRNA SARS-CoV-2 vaccination on clinical outcomes in patients receiving CAR T. We know that COVID-19 has been a leading cause of non-relapse mortality in this population, and there's been a lot of hesitation about vaccinating these patients out of the concern that it may, for example, increase or exacerbate CAR T-related inflammatory toxicities like CRS and ICANS. And on top of that, we do have evidence that mRNA vaccinations can promote type 1 interferon signaling and CD8 positive T cell priming beyond their role in just infection prevention. So that's kind of the main rationale for our study. And we did this retrospective propensity score matched real world cohort study. And we looked at peri-treatment mRNA vaccination within basically 6 months of CAR T cell therapy. And interestingly, we found improved overall survival in the vaccinated cohort. So patients who were vaccinated within 6 months basically had a 40% lower hazard of death within the 2-year follow-up period. And not only that, but they also had lower or significantly lower risks of CRS and ICANS. We also performed a separate analysis on bispecific T-cell engager recipients, and that survival benefit was actually consistent. The toxicity profile did diverge, but that could also reflect fundamental differences in the pharmacology of these therapies. And I think that our results are very reassuring. They're practice-informing, and we would definitely suggest that prospective studies look more into also pre-infusion versus post-infusion vaccination, and we would need prospective validation, of course.